So, good showing
Okay.
this.
Hi, we are here, just got done with chemo, and I am here to introduce the world famous Janice. She's my chemo nurse.
Yay.
She's awesome. And just wanted to put out there a few questions. Like, people have questions like what goes on with you at chemo and what happens to you. And we came up with the most commonly asked question is, when's your hair falling out?
2 weeks after your chemo. Almost count it to the day. Day 14.
It was day 14 for me.
It will fall out.
It was very accurate. Second, how sick are you going to feel? Or
How are you gonna feel?
like what symptoms? Tired, nauseated?
Tired, nauseated, lethargic, achy. About 24 to 48 hours. Usually 48 to 72, I guess.
I thought it would last longer than it did though. It wasn't as long as I thought.
About three to 5 days.
Yep. That's like exactly my stuff too. We're juicing them, so we're feeling good faster.
If you drink a lot of fluids, you will feel
Tons
better
of
much.
water.
Yep. You'll
Yeah.
feel better much.
You told me that the
much
first
quicker,
time,
yes.
and I did. I chugged probably about 10 water bottles.
Because your body takes up the chemotherapy the first 24 to 48 hours. What isn't taken up is excreted. So the faster you flush your body of the excess, the better you feel.
Okay, what was our last question? You said probably.
Yeah, does it
Oh,
hurt?
does it hurt getting it?
Does it hurt to get chemo?
No, not usually. Normally you don't feel it the day you get it. If you have an infusion port, you'll get a little pinch from the needle we put in. That's about it.
Yeah. I don't really feel sick at all while I'm getting it.
No.
Just that Benadryl, but now we don't do that anymore. That makes you really dizzy.
And groggy.
Yeah. So besides that, the chemo itself, I don't know, you don't feel bad during it, do you?
Not at all. I'm actually high.
That's the bonus. That's the bonus.
No, I honestly, I feel really good the day that I have it. And the steroids help. You know, the steroids pump you up and you feel good. But, yeah, wait till Saturday. And then I'm going to be good.
Oh, we get steroids.
Yes.
Yeah.
You roiding.
Well, I'll go get a lift on later.
Yeah.
And the new Lasty you get.
What's that?
And the new Lasty you get a delayed effect. Do you get achy?
That's the achy. I get it in my neck.
Yeah, I do too.
Yeah.
Your
That
neck is
makes
really
the white
fat.
cell count
Yeah.
boosted? Okay.
What are some of the other questions that they ask? What concerns?
Some people get numbness and tingling in their fingers and toes, hands and feet. Is that going to go away after the treatment stop? Sometimes it does, sometimes it doesn't.
Oh, really?
Yeah. Sometimes it will completely resolve, and sometimes it does not. Sometimes the damage is permanent. It doesn't ever resolve. Sometimes it gets a little bit better after the drugs stop, but sometimes the damage is permanent.
What is it? Damage to what?
It's a damage to the nerves.
Oh, really?
And the feet and the fingers, yeah. The
Oh.
carboplatinum will cause that. But that's why we tell patients if that happens, they need to tell us.
Okay.
Because then we have to dose reduce the drugs or stop.
And that's a big thing, and you should be telling her all the time, right? Tell them everything. Everything.
She doesn't tell us everything.
Everything. Yes, you gotta tell everything.
Oh, in the mouth.
The mouth ulcers, yes.
Ulcers are-
Things like that are
those
not
terrible.
normal.
Now
And-
that's just rinse with salt water?
There's also another medication called Magic Swizzle that we can give you that will,
Magic Swizzle.
yeah.
I could not think of
It's
that.
Benadryl, viscous lidocaine, and Malox or Mylanta, depending on what
Where
the
do you
drugstore
get
puts
that?
in it. Yeah, it's a prescription. And you can swish it and spit it or swish it and swallow it. Well, we're hoping this time now that we modified your doses that you won't get that.
Maybe hot food. Can't eat spicy food. You can have that.
Man, no.
So is there, one of the biggest things that I know from my perspective and Michelle's perspective, immediately when you think of you got cancer, you're going to go through chemo, it's a scary thing. It's a very scary thing. But as you can see down here, it doesn't have to be scary. When we go all the friends and everything like that, we have a lot of fun, right?
Yeah.
So, and that's one thing, I think attitude is part of that. And Janice always makes it fun.
Oh, thank
It's
you.
not
I tried.
Keeps alive.
Fun, not scared.
Yeah, fun, not scary.
We don't like scary.
Yeah.
We don't like scary.
All right. Take care.